if I recall the statistics correctly, Nigeria represents more than a quarter of global malaria-related deaths. So Nigeria is front and center when it comes to malaria. So anything about the importance of malaria means importance to Nigeria, for sure. I am extremely excited about the new vaccine. It's been a long time coming, as I think some of your other questions will mention. And it's been malaria is a very, very difficult target because malaria is caused by a parasite, not by a virus or a bacteria. So it's been scientifically extraordinarily challenging to develop this vaccine. But I am very, very excited that we finally have one. Well, I think the first lesson is the one that I referenced in my previous answer, which is that malaria is a very, very scientifically very, very difficult target. Targeting a parasite with different life stages and different biology is extraordinarily difficult. And there were many who said it could not be done. Nonetheless, scientists work for many, many years to come up with a vaccine candidate, and there are a few more in the pipeline that may come to fruition. There's a second thing to remember about the COVID vaccines and the speed at which they were produced, which is that they were going after a virus that is very closely related to other viruses that we had already studied for years. On top of that, there were more than 100 vaccine developers who were working on the coronavirus because it was a global problem all at once that came on suddenly. And so there was a fairly sudden scientific response. Many, many, many of those vaccines are still not available or approved today. So that tells you not only about the commitment to COVID, but it actually tells you about one other thing that's true about vaccines, which is that there is a part of the scientific process is random chance. Are you going to choose the scientific avenue that works, or are you going to choose one of the dozens or hundreds that don't work? And that's one of the facts of science, that you cannot control the timing. Except insofar as you're willing to spend lots and lots of money that may never give you a return. The first question is, how can we afford not to? The level of death and family loss compounded with the impact on the economy of those deaths and those losses is inestimable. I can't speak to the accuracy of that particular costing analysis, but certainly vaccinating across 40 plus countries is a tremendous undertaking. There are several financing mechanisms that will help. And that includes Gavi has made a commitment to supporting the malaria vaccine as part of its rollout. And there is WHO endorsement of the commitment. Governments themselves, where they're able, should also be extraordinarily committed to protecting, especially children who suffer particularly disproportionately from this disease. Well, like the COVID vaccine, there are multiple public health interventions required to truly get to either epidemic control or eradication. And as you know, across the continent, we've worked very hard on other strategies like bed nets and treated bed nets, like seasonal malaria chemoprophylaxis in places where that makes sense. Like malaria treatments, like protection for pregnant women. And now we add vaccines, like vector control. Sorry, I'm missing a big one, vector control, killing mosquitoes and keeping mosquitoes from coming in. So I think it's extraordinarily important that we add vaccines to what is already a tremendous commitment on the part of governments and on the part of donor organizations to combat this terrible disease. If you look, there have been, some specific areas that have had a chance to eliminate malaria for periods of time. And there have been others that have tried very hard but haven't gotten there yet. It is my hope that adding the vaccine to our existing efforts will tip us over the edge, and we will see far more parts of the continent controlling malaria. I think the first thing to remember about vaccines or any intervention is we have to effectively communicate the relevance of the intervention to families, to parents, to communities at large. And I have been perhaps a broken record or driving some people crazy by saying that we have failed to communicate until we talk to me in my language about my context through some trusted advisor, somebody I trust. And I think those three things are extraordinarily important in terms of communication. My language, my context. And let me say more about context. Maybe I'm pregnant. Maybe I'm thinking about getting pregnant, or I'm thinking about my wife having children. Maybe I have immune compromised people in my area. Maybe I'm taking certain kinds of medications. We have to explain how the vaccine fits in with my life. And then the person who explains it probably can't be Marian Wentworth sitting in Virginia. It's got to be somebody that I know to be trusted. And that may be a government leader, a scientist, a faith leader. The person that's trusted could be of many kinds of backgrounds. But again, it's my language, my context from my trusted advisor. What's important for me, working from a global perspective, is to reiterate what I said to you just a minute ago to anyone I can, my language, my context, my trusted advisor. And those of us who address or examine phenomena that we call vaccine hesitancy recognize the importance of local leaders. Those of us who work on preparedness plans, like pandemic preparedness plans, also recognize the importance of local leaders. And then MSH, when we work in a particular area, it's very important for us to do a scan of key stakeholders. And that includes local leaders, and to bring them into the work we do. It's part of what we call our Tao of leadership, that we really have to go into a place where we work and make sure that we understand who's involved, that we love them, that we learn from them, and that we start with what they know. This is part of our DNA, our core. And it's something that I try and espouse across as many stages and conversations as I can.